About the colon cancer, there are 3 facts. The first one is this cancer can be diagnosed at any age. Majority of the patient with colon cancer is older than 50 years old. But nowadays, the rate of patient with colon cancer that younger than 50 years old is rising. So, if you have the symptom of the colon at any age, please go to see the doctor. The second fact about the colon cancer is this is the highly treatable and curable cancer. For the early stage of the cancer, the 5-year survival rate is around 90 to 92%. In the case that cancer spread to the lymph node beside the colon, the 5-year survival rate also high, around 70 to 75%. Moreover, for the stage 4 of the colon cancer, in some cases, such as the liver distant metastasis from the colon cancer, the 5-year survival rate rising to 50 to 60%. The third fact about the colon cancer is in the early stage of the cancer, the patient may not have any symptoms. The symptom will develop after the tumor getting bigger or advanced. Then, the result of the treatment will be different between the early stage and the advanced stage. The importance of screening colonoscopy examination when you have the risk is important. This examination will prevent you from developing colon cancer. The colon is the organ that helps to remove the solid waste food from our body. So when you get the disease of the colon, it will affect your stool. The common signs and symptoms of colon cancer is included bowel habit change, diarrhea, constipation, bleeding from the rectum, blood mixed with stool, or abdominal discomfort such as cramp, pain, or feeling that you cannot empty your bowel. In some cases, patient has to go to the toilet 5 or 6 times a day to empty the colon. These are the symptom signs of colon cancer. And for non-specific symptoms about the cancer, it's gonna be anorexia, it means that boring to eat, lost the appetite, feel nausea, vomiting, weakness, or somebody has the anemia, it means that the concentration of the blood is decreasing. The patient lost the blood in the stool from the tumor. We categorize the colon cancer into 5 stages: stage 0, 1, 2, and 3. For the stage 0 and stage 1 and stage 2, we call it localized cancer. It means that the cancer still contained in the colon, in the bowel, not spreading to the other part of the body. For stage 3, it means that the cancer spreading to the lymph node beside the colon. And for the stage 4, it means that the cancer spreading from the colon to the other organ in our body, such as lung, liver, bone, or brain. Most of the patients that come to see the doctor always come with the stage 2 or stage 3 of the cancer because the tumor is getting bigger and can disturb the colon function. For the stage 0 and the stage 1 of colon cancer, we often find it during colonoscopy examination. This is the benefit of health annual checkup, with particularly in the patient without any symptom of the colon disease. The treatment of the colon cancer is up to the stage of the disease. The treatment also includes surgery, chemotherapy, and radiation. With the advanced technology, now we can perform laparoscopic or robotic approach to do the colon resection. The benefit of laparoscopic and robotic surgery is less pain, small incision, fast recovery, and less complication. Moreover, we can preserve the sphincter of the colon with these 2 approaches. Then the patient doesn't need a permanent colostomy. For advanced chemotherapy, our hospital has the targeted therapy that precisely kills the cancer cell and saves the normal body cells. And the novel treatment is immunotherapy. This medicine will boost our immunity cell to fight with the cancer. So this will cause less complication, and the patient will have better quality of life than the chemotherapy. For the radiation treatment, our hospital has a new machine with the edge technology, which provide the accurate radiation to kill the cancer cells and less side effects. The result of the treatment will be better than the conventional radiation. For the colon cancer, I would like to emphasize that the early stage of the colon cancer may not cause any symptoms. So, screening colonoscopy examination is important. For the patient with the colon cancer, with the advance in surgery, oncology, and radiation, which improving the survival and provide a better quality of life. The colon cancer is not frightening as you may think. So if you have any abnormality of the colon symptom, please seek the medical attention as soon as possible.